All right, so we're going to talk about assessment and treatment of body dysfunctions of the coccyx. Specifically, just to keep it simple, we're going to look at side bending, right versus left. The other body dysfunctions are extension or flexion. With extension, it's a pretty easy thing to actually treat where, let's say there's an extension dysfunction and I actually resist, I block that extension and I resist through knee extension, okay? I'm not going to show that in this video other than just to kind of talk about that. When there's a flexion dysfunction, however, it's really hard to treat externally. So if you're someone that treats internally, that's the best way to work on a excessively flexed coccyx. Or you refer out to someone who does that to get them to assess it internally to confirm, yes, it is flexed and it needs to be treated. Oftentimes there's other soft tissue considerations that need to be worked on as well if there's a flexed coccyx. So to look at the side bending piece of the body, I am going to have her draped, have her basically her pants pulled down to the point where I can get on the coccyx well. Make sure you get consent and then slide down onto the coccyx. And I like to get to where if let's say this is the coccyx here, like this portion of my fingers, I'm sliding down basically with my middle finger and then my index finger and ring finger on either side. And I just make sure I can go all the way down almost to where I can like hook onto the very point. And then I'll actually slide back up and then I'll dive off to the right or to the left side and then dive off to the right side and just check and see how much space is on either side. If there's less space on one side, let's say there's less space on this side and it feels like it's side bent, then I'm spring testing to see if I can push that coccyx back towards the middle. If it's stiff, then I want to mobilize it, okay? So I'm going to slide down onto that coccyx, slide off to the left side, slide off to the right side, and there is significantly more space on the left side than there is on the right side. So from that assessment, I want to mobilize the right side to try and get it a little bit more neutral, okay? So in order to do that, I want the dysfunctional side up because I'm actually going to try and pull it down. So lie on your left side, Kelsey. I'm going to take this. We'll put that there. We'll put this between your legs there. And I'm going to take this stool. Okie doke. Now, raise this up a little bit. Now, I have, the coccyx is side bent off to her right side, all right? And I want to hook onto the border of it and relatively pull it back down. So I'm going to slide on to her coccyx. I like to have a second hand on the client just from their kind of comfort level. Sometimes if you just have one hand on, it can make people feel not as secure. So I have a second hand on just to allow them to relax. And then I'm on the top border of that coccyx, and that is stiff. So stiff that it feels like there's a lot of soft tissue there that I would ideally want to work on first, but the purpose of this video is to talk about the joint mobilization, so I'm going to go ahead and work on that. So now I am blocking, pulling it down. I'm going to keep it there, and then I'm going to see what motion she can do to bring more tension into that hard infield, right there, okay? So go ahead and tilt your pelvis forward versus back, an anterior tilt versus a posterior tilt. Woo! And that posterior tilt brings it right into my fingers. So do neutral to posterior tilt right there. And so that's one option that I have from a functional mobilization standpoint to mobilize that. Now, my favorite things to do, let's stop that, is why don't you just raise just your top foot up towards the ceiling, and that creates a little internal rotation, which that actually doesn't really do much for me. Let's do both. Let's do both feet up towards the ceiling, and that does a bit more, okay? So what I would probably actually have her do is posteriorly tuck your pelvis right there. That engages it really well, and then take your fingers up to, or your feet up towards the ceiling. Good, and just up and down there, maintaining that posterior tilt. Good. And so again, and go ahead and stop there, I would just continue to mobilize that until either it became springy or it wasn't improving anymore. I'll take her back onto her stomach, feel, does it feel like that side bend has corrected? If it does, well, whether it does or whether it doesn't, I would then recheck all of the post-tests that I'm interested in checking to see, was that a beneficial treatment for that client? And treating the coccyx more than any other area, no, well, that maybe not true. Just because the vulnerability of the coccyx, you want to make sure you do post-test, because if there is a big difference, then you're going to build so much more trust with your client than if you just treat the coccyx and then don't do any kind of post-test. They don't know any changes that you made, and then you continue to go back and treat the coccyx in future visits, and your client's like, why in the world would they work on this area? Because it doesn't necessarily make sense, even if you've explained everything really well. If they feel a difference after working just on that area, it's so much more important to them. So that is treating the body dysfunction of side bending of the coccyx.